I'd like to now welcome Jane, who is the Relationships Manager for the Business Growth Team at Your Side. She is a qualified social worker and passionate about supporting people to live their best lives, living independently in their own home or in supported accommodation. Jane has been working in aged care for over 10 years with an experience as an ACAT clinician, a home care package manager, a business development manager, aged care coordinator at Sydney North Health Network, and now relationships manager at Your Side. Jane is passionate about collaborating with services to ensure our clients receive the best possible outcomes. Your Side is a leading provider of support services for older people and people living with a disability or mental illness. This also includes services to support carers, and they are an NDIS, an aged care registered provider based in Sydney. So please join me in welcoming Jane to her presentation this afternoon.
Thanks, Michelle. Thank you for having me this afternoon. So I'll just wait for my slides to pop up on the screen. But like Michelle said, my name is Jane Meccelli and I work for Your Side. Today, I'm going to talk to you about how to access aged care services, how to access the National Disability Insurance Scheme, or NDIS, as is more commonly known, and also how to access Carer Gateway. So let's get started. So I would like to acknowledge the traditional owners of this land and recognise their continuing connection to land, waters and culture. I pay my respects to elders past, present and emerging. All aged care services were centralised through My Aged Care in 2014. The purpose of centralising the services was to make service navigation easier. Arguably, it has made the system a little bit more complex. So I will briefly cover some of the key points of service navigation to ensure that you can access support well before it is actually needed. Firstly, to be eligible, you need to meet the age criteria, which is over 65 or 55 if you are Aboriginal or Torres Strait Islander, and you must have a care need and be frail aged. And I would like to mention at this point that we do identify people who are socially isolated as having a care need that does need to be managed through aged care services. So the first step is to contact My Aged Care, either via the 1800 200 422 number, or you can self-refer online, which I will cover in more detail in a moment, or you can also ask your GP to refer you. And here is a screenshot of the My Aged Care website. So when you click on the tab that says assessment, you then click on the apply for assessment online. And if you are referring a family member or friend online, please make sure they are close by, as the referral does request identification documents such as Medicare cards, DVA cards, or healthcare cards. Once the referral has been completed by My Aged Care, you'll be allocated an assessor who would usually do a face-to-face assessment. However, with COVID, all assessments are happening over the phone. If My Aged Care identifies that you have low-level care needs, then they will send someone from the Regional Assessment Service. However, if you have more higher care needs, an ACAT assessment will be allocated instead. The home assessment will identify what your care needs are, see what supports are already in place, and what additional services will be useful to ensure that you can remain living at home safely, unless, of course, you're being assessed to move into residential care. The two services have different approval permissions. RAS can only approve for the low-level Commonwealth Home Support Program, which I will cover in more detail, but they will refer the client to ACAT if they identify that their care needs are much higher. ACAT can approve for all services under the program, including residential care, which most of us still refer to as nursing home care. Okay, so what services are we actually talking about? Here is a simplified version of aged care services. There are three types of services that you can access. There is the Commonwealth Home Support Program, or CHSP, home care packages, or HCP, and residential care, which, as I said earlier, many of us still refer to as nursing home. And so what is the difference between the Commonwealth Home Support Program and a home care package? Well, CHSP services are simply entry level for clients who are managing well at home with minimal support. The regularly requested or approved service is usually for domestic assistance and maybe some social support. The list of services available under CHSP are extensive and they can be all accessed via the My Aged Care website. The program is not means tested, so you usually pay around $15 an hour for services, unless you participate in group social support where the cost may be a little higher depending on the activity. Under CHSP, you will receive multiple services from multiple providers. Home care packages, on the other hand, have 4 levels and each level has its own funding. Level 1 gives you approximately $9,000 a year, and level 4 gives you approximately $52,000 a year. And here at your side, we actually, being a not-for-profit, that actually means we can do approximately 17 hours a week on a level 4, so it's quite a significant jump. Home care packages are provided by one provider, and the client cost associated with the home care package is determined from the income and assets test you must complete through Centrelink. Home care packages are consumer directed, which means that you are in charge of the types of services you want to receive. During COVID, as an example, here at your side, we have a client that wanted to purchase an exercise bike to maintain their physical health while they were unable to go to their regular physiotherapy classes. And this is a visual representation of the difference between home care packages and CHSP. And just to let you know, the system is being reformed, and so eventually the system will become a lot more simple. Here is the current home care package subsidy you can expect to receive on home care packages. As you can see, the hours of care on each package can be varied depending on what service you access and which provider you work with. So for those playing at home, on a level 1 package, you can receive anywhere from 2 to 2.5 hours a week, up to a level 4 package where it can be anywhere from 12.5 hours all the way up to, like I said earlier, about 17 hours a week, depending on what service you want. In addition to the home care package subsidy from the government, you can also access a range of supplements to meet any additional care needs. Residential care or nursing home care approvals are also accessed through My Aged Care. Often clients are approved for residential care when they receive an approval for a home care package. Clients can be approved for residential care while they are in hospital and will be approved for low-level respite, high-level respite, and permanent care. When entering permanent residential care, clients do need to complete an income and assets test through Centrelink, as I spoke to before, and that determines how much they need to pay for that facility. Some residential care facilities do have their own fees and bonds that are set that you must pay. Okay, now onto the NDIS. So the NDIS came about as a result of public inquiry by the Productivity Commission to provide services to people with a disability with choice and control. The National Disability Scheme kicked off in July 2016. Prior to 2016, there were some NDIS trials happening around Australia, which now informs the program that we see today. The NDIS exists to give people with a disability choice of provider they purchase support from, the type of support they receive, and how they receive the support. So who is eligible for the NDIS? You must be under the age of 65 at the time of applying. You must be an Australian citizen or have permanent residency, or you may have a special category visa. You also need to have a permanent and significant disability under the guidelines. To apply, you call the NDIS to make an access request. And for those unable to see the screen, the number to call NDIS is 1800 800 110. NDIS requires supporting documentation, including, of course, proof of disability. And your local area coordinator, or LAC as they are known, can also assist with this process. If you're in hospital and needing support to access NDIS for the first time, please ask to see the hospital social worker and they might be able to assist you with getting this process started. Once you are approved on the NDIS, we'll have a plan that lists your goals and your funding. The funding is designed to purchase support, such as assistance to access the community or assistance with domestic tasks, and the list really goes on. The goals you develop can include things like wanting to live independently or gaining employment, and again, the list goes on. And these are the key principles that drive the NDIS, in that people with a disability should have the same opportunities to pursue their own unique goals and dreams. Participants have choice and control over the provider they use and the services that they want to access. The NDIS aims to strengthen the ability of people with disability to participate in community activities of their choice, form relationships, and spend their money how they choose. And finally, the NDIS aims to support people to learn skills that increase their independence and ability to participate in society. And look, finally, just a few things to keep in mind with the NDIS. The NDIS does not replace or fund support systems provided under the healthcare or education system. The NDIS will only fund supports that are considered reasonable and necessary. And the NDIS will not fund supports that are likely to cause harm, or they are not related to the person's disability, or supports that duplicate other supports already being provided, and any support that relate to the day-to-day cost of living. Okay, and last but not least, I'm going to talk about the new National Carer Gateway services. I say new, but it actually launched on the 6th of April last year, smack bang in the middle of the pandemic. And the reason I'm talking to you about National Carer Gateway today is that your side is one of the many providers that do this service across Australia. So to begin with, I would like to explain that the Carer Gateway supports carers. Now, this might be a simple definition, but one that can sometimes get a little bit lost in translation. We support carers who look after someone with a disability, a mental health condition, a medical condition, which may also be terminal, or someone who is frail aged. The program is open to any carer as it is not means tested, and you can access this program even if you are on a funded government service such as NDIS or My Aged Care. Carer support is delivered nationally through the Carer Gateway. The Carer Gateway includes a website, phone or online services, and face-to-face services, which are being delivered by what we call regional delivery partners. And like I said earlier, your side is one of the many providers of this program. Carers simply need to call 1800 422 737 Monday to Friday to access carer services, or they can head to the website and click Request a Call Back. The website is easy to navigate and contains resources and information to support carers in their role. And all the services I will cover today have been as a result of 2 years of consultation with carers for carers. And if there's any health professionals online, please make sure you jump on this website if you've not done so already. It has some fantastic resources that you can print and hand out to patients. So once you've called the 1800 number, you get allocated through to an organisation in the area that you live, and they complete what we call a carer support plan. So as part of the intake and registration, we are identifying who the carer is. It's important to note at this point as well, the carer doesn't necessarily need to live with the person that they care for. The common example is carers looking after elderly parents, but they do live at home with their, their husband and their young children, but they are predominantly the main carer for their parents. We look at what their needs are. So it's a process around understanding what their current needs are to do the support planning process. And planning is really identifying the types of services and support the carer would need. Through a process of coordination, the carer and the service provider will provide support to make sure that they can access the service that's been agreed. And service is obviously the appropriate service to that carer. And check-in is the best part of this whole program, because once we have put all services in place, completed the assessment, we will actually be calling the carer back every 3 to 6 months and see how they are going. And we do what's called a wellbeing check against the STAR assessment tool, which I'm going to show you in just a moment. And here's the carer STAR tool. It's an evidence-based tool that measures where carers are in their caring journey. So we look at the 7 key areas, which are just on the outside of the star that you can see there, which is the health of the carer, the caring role, how they're managing at home, do they have time for themselves, how are they feeling, how is the carer managing their financial situation, and do they have work considerations on top of their caring role. We then look at the scale within the key areas. So if we've got number 1, cause for concern, that's when we're really looking at what supports are going to be necessary to support the carer. Or if we get up to number 5, it's as good as it can be, then we're usually quite happy with that. This tool we do at the first assessment process, and then when we check in with the carer every 3 to 6 months. And here is a huge list of the services that carers can access through the Carer Gateway. So on the screen, you'll see some services, the face-to-face services, and I'm going to go through these in a lot more detail. But if you're a carer who's a little bit reluctant to be formally registered through the Carer Gateway, that's okay, because through the website, you can access some phone counselling, online peer support forums, which is like an online chat forum, chatting to other carers. There's also online self-guided coaching and online carer skills courses. Okay, and these are the services that you can access. So emergency respite is for when a carer experiences an absolutely unexpected emergency, but they really can't leave the person they care for unattended for a period of time. So the Carer Gateway will talk to the carer to identify what supports are needed, and we usually arrange them pretty quickly. So an example that I often give people is that the carer's had a fall and they've hurt themselves and they need to go to hospital. So we get a call through the 1800 422 737 number, and we arrange some quick services. We then call the carer back at a later stage, so a week later, 2 weeks later, and we want to see how they're going, and we then do the assessment at that point. The reason that we contact the carer back is we want to see if that emergency was something that happened just as a one-off, or are they just not coping in their caring role, and it is possible that more emergencies will continue to happen. So we really do exist to support carers as best we can. Carers can also access carer-directed support packages, and we use these packages to do things like purchase laptops, and so that carers can do, online courses, or they might want to link in with some online peer support groups. Then through through the support package, we can also arrange services such as domestic assistance, personal care, respite care, and the list goes on. At the moment, we're providing a lot of these services while carers are waiting for funded service plans to come through, particularly through My Aged Care, as we do have a wait list for home care packages, or also for NDIS, there is still a little bit of a delay because of COVID. So we also provide in-person peer support. So carers are linked with other carers, and the groups are facilitated by someone who is a carer themselves. It's a really great opportunity for carers to meet other carers who are experiencing similar challenges to them. And the peer support groups are encouraged to meet each other outside of the facilitated sessions. At the moment, due to COVID, these sessions are happening online, but prior to lockdown, carers were able to connect face-to-face at local centres all around Australia. The next service we have is counselling, and this is for carers who are experiencing difficulties with anxiety, stress, depression, or low mood related to their caring role. Carers can access 6 one-hour counselling sessions, and yes, they are free. And the counsellor and the carer meet each other at a location that suits them. Obviously, at the moment, a lot of sessions are happening online or over the phone. And then we support young carers here at the Carer Gateway. And it is so important because young carers are often the primary or secondary carer within the family, often with a family member with a disability. So it is important that young carers are supported so that they're able to complete things like schoolwork and, more importantly, manage their own self-care. We do lots of online sessions with the young carers, and we also have peer support groups. And prior to lockdown, we were actually able to have a few retreats with our young carers, and it was such a great opportunity for them to meet each other, because I think being a carer is an incredibly isolating role. So these teenagers really enjoyed meeting other carers in the exact same situation as themselves. Once lockdown ends, we're really hoping that we can get these weekends away happening again soon. And finally, the last element of the program, and we have just launched, is facilitated coaching. And this is a non-therapeutic program where carers work with a coach over 6 sessions to meet a goal of their choice. Goals can include things like returning to the workforce, gaining skills and knowledge on the particular disability or medical condition they are supporting. And really the list goes on. And here is a snapshot of services delivered so far. I recently met with all the New South Wales Carer Gateway providers, and we're all pretty much doing very similar things. So we do a huge amount of information and referral to other services, a little bit of advocacy as a result as well. So accessing NDIS and My Aged Care, lots and lots of respite care, personal care, domestic assistance, purchasing lots of laptops at the moment. Lots of carers are really wanting to be able to connect with other people online. We're doing a lot of tutoring for young carers, particularly our HSC students. We pay for driving lessons, counselling sessions, emergency respite, and really the list goes on. It's a fantastic program. If there's any carers listening and you're not linked in, make sure you give the Carer Gateway a call. So, and just quickly, I would like to provide a little overview about Your Side. We are a not-for-profit provider and we've been around for 30 years. The services we deliver are the Commonwealth Home Support Program. We do home care packages, the National Disability Insurance Scheme, NDIS, Carer Gateway. We are funded to do Carer Gateway in Sydney. And we do private fee for services, and we do this to top up NDIS plans or aged care services, but we really do not promote ourselves as a private provider. And then one of the amazing and wonderful parts of my role is that I get to coordinate a group called Community Circle. And the group came about as there were so many people out there needing information and support to navigate the complex world of mental health, disability, being a carer, and aged care. So I do a monthly newsletter, which is informed by the group, and I also arrange monthly education sessions according to what the group want to learn about. We currently have over about 1,100 members, and membership is free. So if you are interested, please do not hesitate to join through the Your Side website. And this is just a little visual snapshot of services that we do here all across Sydney. So the Commonwealth Home Support Program, you'll see there that we do a number of services specific to areas of Sydney that we've been funded by the Department of Health. We provide core supports for NDIS participants over the age of 18. So we do things like personal care, lots of community participation and allied health services at the moment, and the list goes on. And finally, the world of home care packages is incredibly competitive. And at Your Side, because we are not for profit, like I said, we can do up to 17 hours on a level 4. Now, for anyone who's online who receives a home care package, feel free to nudge your current provider if you're not already getting those wonderful service hours that you can see down there. I'm a troublemaker, but I don't care, because we should all live at home for as long as possible. And that's pretty much what we do over here at Your Side. Wonderful organisation to work for, let me tell you. And at that point, if anyone has any questions.
My son-in-law had a stroke and was told that he was not eligible for NDIS as it is not a permanent disability. What can I do to access these services for him?
So you really need to have a lot of supportive documentation from, treating speech pathologists, specialists and doctors. The best thing to do is work with an LAC and get all of that supporting documentation happening. If you're also a carer for your son, you can, through the Carer Gateway, mention that you are struggling to get your son onto NDIS, and they can also help you with some advocacy and support as well. So there's a couple of things you need to do, but essentially as much supporting documentation as you can get together is really going to be the key.
And a question that came to me on our telephone counselling line, which I'm going to put to Jane, is that a lady was I guess, told by the hospital to find a specialist support coordinator to basically help her access the NDIS services. Would you know what they were meaning by that as a suggestion?
No, because you don't usually link into a support coordinator until you've got an NDIS plan in place, and you need to have that budget, allocated. So, yeah, that's an unusual thing, but there's sometimes a little bit of disconnect around what information is correct with regards to NDIS. So yeah, I would always say to people, go to an LAC, or you can call even any NDIS organisation. They should be able to give you a bit of information to guide you on the right pathway. That's what we do a lot of, I find, from our NDIS team.
Yep. And does Carers Gateway have translators?
Yes, we cover all languages on Carer Gateway. We use the phone interpretation service. And I know quite a lot of providers even have just within their team a lot of languages as well. But yes, all languages are covered.
Okay, excellent. And what advice do you have for new clinicians, physio, navigating ACAT? Is there enough information on the website to gain a good understanding of what's required?
If you're talking about what's required for an ACAT assessment, there's a bit of information on the My Aged Care website with regards to what ACAT sort of assess for. If you're working in health, I would recommend contacting your local ACAT. They're usually happy to provide you with a bit of information as well. They're usually quite collaborative.
Okay. And another question is, does Carers Gateway have funding and grants for individuals?
We don't give the funding directly to the individual. So what happens is if a carer would like to receive services and support, they contact the Carer Gateway and we do an assessment. Through that assessment, we identify what their care needs are. So if it was to, like I said, purchase a laptop, we wouldn't actually give that money to the carer. We would purchase the laptop on the carer's behalf and have that arranged, have it posted to their home. But we don't actually give the funding to individual carers.
I have my aged care package, but I've been told that there are no providers in my area, so can't get services. I'm not sure what area that is. There was no indication of what area that is, but I guess that means that there was no services who had spaces in that area. Would that be a common thing that occurs?
Definitely. So the Commonwealth Home Support Program is what we call block funded. So when providers get, they fill all of their service availability, they can't provide more services. So, for example, domestic assistance, like I said, is often requested, and usually that's the first service that providers just fill really quickly. The other problem as well, as we all know, is there's a huge wait list for home care packages. So people, there's a lot more pressure on the Commonwealth Home Support Program to support people while they're waiting for home care packages. So my advice to people is, just get on the My Aged Care website regularly to look at what's available. If you're not confident, make sure you contact a community social worker in your local, community centre, or even contact one of your local aged care providers. They should be able to help you sort of navigate through the My Aged Care website. But yeah, it is a bit of a problem at the moment that there's not always availability for services as much as we would like.
And I guess one of the real disconnects with most of these processes, whether it be My Aged Care, NDIS, and even Carers Gateway to a degree, is just finding the services and then being able to fill out the forms and having the patience to do that. We're often dealing with a clientele who are not cognizant and very educated in how to use computers. And even when we are, case in point me, they don't always work to the way you want, and you can often be filling out the same form, saying the same thing 100 times. And I guess my question is, are there any services out there that you're aware of that can really talk somebody through that whole process of filling out those forms and getting that support? Because it's just getting that process happening that's often a real barrier for people.
Definitely. And I know that our aged care team are walking people through this process every day of the week. It's one of my very insightful colleagues said to me that the current system is made for the baby boomers who are really great on computers. It's not made for the current aged care clients that we're seeing. So again, like I said, I really rely on the local community centres and the local social workers, in local community health centres. You know, in theory, it would be great if you could go and spend time with your GP and get your GP to help you with that paperwork, but GPs are so incredibly time poor. So yeah, I would really look to local community centres and local community health centres if they can. If you really struggle, like I said, you can try a few of the aged care providers. Sometimes they can help you spend some time to navigate through that system. But yeah, Services Australia do sometimes help you, but again, sometimes you're on the phone for a little while. So yeah.
And just a follow-up question from one before, is there any written documentation that can give you an indication of what you're going to be asking your healthcare provider to produce in order to get an NDIS package? I guess one of the things we find, particularly with stroke survivors, is that they present documentation and then they're knocked back. They have to go back and fill out more forms, find more information, and that process can go on for some time, and people are often left in limbo during that process. And while we do understand that it is important to verify people's claim for an NDIS package, it's also a process that can really limit somebody's ability to continue their recovery.
Absolutely. And if they don't have money for those specialist assessments, it can also become very expensive as well. Look, we would recommend that people go to the local LAC. I do believe through the NDIS website there is a lot of information around, you know, what sort of supportive documentation you do need. With regard to that early stage of NDIS, that is not my area of expertise, but I do know that, yeah, LACs tend to be the first port of call because they should be able to support and advocate for your participant to get onto NDIS.
And so the first port of call for most of these things would be a website. Would that be correct?
Yeah, if you can. Some hospital social work departments have got some information put together about NDIS as well. So sometimes that's a useful resource. But yeah, unfortunately, the best way to start is either on the website or calling NDIS and just really getting an idea about what's going to be required, and then sort of moving forward from there. And if you keep finding that you keep getting knocked back, you know, you can make complaints. I think that people forget that, you know, you can put a complaint in to say that you feel like your case needed to be heard and needed to be looked at. So, you know, like I said, I'm a troublemaker. You know, I highly encourage other people to be troublemakers as well, because if it's a difference between you coping at home and not, you know, I would really advocate for you to put complaints in if you're not being heard.
Okay, just some further questions. Do you have any further information on My Aged Care, on the My Aged Care reforms you mentioned earlier?
How long is a piece of string? Look, the Aged Care Royal Commission completed their report last year. There was a lot of recommendations that have been put forward to aged care providers and nursing home or residential care facilities. We're looking, we hope, in about 2023 to see a more streamlined approach to aged care, where it's going to be one service rather than different layers of services. But at the moment, we don't really know how that's going to look. So like I said, the recommendations have been put forward, but as to how that's going to look in the real world, we're not 100% sure as yet.
And what fees are included in Carers Gateway services?
Carer Gateway is free to access. For emergency respite and the carer directed support packages, we do ask for a 10% client contribution if you can afford it. A lot of clients can't. A lot of carers come through that are just so financially stressed, so we do waive the fee. But yeah, the only reason we charge that 10% is just to put a bit of value behind the service, because we have found that, you know, carers will cancel services last minute. We still have to pay that support worker for their time. So we find the 10% just kind of keeps carers a little bit more responsible around cancelling services if needed. But like I said, we rarely charge it these days because carers are just so stressed financially, and COVID has really exacerbated that.
And can I ask you to explain a little bit more about LAC? What does it stand for, and what sort of services could somebody expect by contacting an LAC?
So LACs are called the local area coordinators. Again, they do a tender process like we do for all of our other services, and they are funded to help people access the NDIS and to also get their plan put together for the NDIS as well. Some LACs will provide ongoing support for NDIS participants, and NDIS, if you look it up on the website, LACs, you can find their details, through the NDIS website, and they're all across Australia.
And so they would provide, I guess, assistance for NDIS. So for My Aged Care, there'd be somebody different. For NDIS, there's someone different. And for Carers Gateway, there would be somebody different.
Yeah, definitely. And like I said, look, it's always great to go through the general numbers, the 1-800 numbers, because they will point you in the right direction. If you want to link in with your local LAC and computers is not your thing, ring NDIS and they can point you in the direction of your local area coordinator, or you can ring a local NDIS provider and ask them who the LAC provider is in the area. They can give you those details as well. With My Aged Care, again, it's really good to go through the 1-800 number, and again, same with Carer Gateway.
And what if you are over 65? Is the only option for support My Aged Care?
Yes, unfortunately. So if you're someone that has had a stroke and you've turned 50, you're 65 or over, unfortunately that puts you into the aged care system. Yeah, so we've done, we've got people onto NDIS literally in the 11th hour when they're about to turn 65. They were 64 when they had their stroke, and we just fought for them to get onto NDIS quickly before they turned 65. But at the moment, there is absolutely no wiggle room, that if you are over the age of 65 and you have a disability from stroke or anything else, you do need to go through My Aged Care.
And you alluded earlier to the fact that various support organisations charge a different fee. So can you explain why that's not a standardised fee by the government, and what's involved in the decision of how that fee is set?
So you're talking about home care packages?
Yes.
Yeah. The government basically has said to providers that you can charge costs to manage your business costs, essentially. Some providers have made the decision to charge for case management, and other providers will do case management for free. Here at your side, we're not for profit. We don't believe in charging extra fees if you don't need to. Like I said, the only fee that must be charged is the income tested fee for a home care package. We can't actually waive that fee, unfortunately. That is determined by the government. But outside of that, within the package, we try not to be sneaky and add any little hidden costs. So there are some providers, I do understand that, if you're on the phone to them for 15 minutes, they'll charge that to the package, almost like if you were, meeting with a lawyer or something like that. So it's important to keep an eye on your statement that you receive once a month from Medicare to make sure that all of your fees that are coming out of your home care package are what you want. And if your provider is not giving you the hours of care that you really believe you should have access to, there's 900 providers in Australia. So there's chances are you could probably find another provider to give you, a bit of a better deal.
Okay, and with NDIS, once you've reached 65, do you continue to stay on the NDIS project and program, or do you then move on to the My Aged Care, program?
Stay on NDIS. There's no reason that you should move over to My Aged Care. There'll be a little bit of nudging from departments occasionally, I think, to try and encourage you onto My Aged Care, because it's arguably a cheaper program for the department to fund. But no, if you're already on NDIS prior to turning 65, stay on NDIS.
And I guess one of my issues, and you and I have talked about it a lot, is the fact that there are various different providers in every area, and everybody seems to do it differently. And it's very difficult then, I guess, for advocacy organisations to be able to say, this is what's provided under NDIS, this is what's provided under My Aged Care, because every provider, I guess, seems to work on their own set of rules. And I'm wondering whether or not there's any move by government to standardise those organisations in some way, because that's what the whole thing was supposed to be about. It was supposed to be about standardisation to make life easier for people with a disability to understand and access the system.
With aged care, like I said, the Royal Commission unpacked a lot of that behaviour where every provider was so incredibly different, almost to the detriment of client outcomes, because it created quite a confusing system for people to navigate. They didn't know who was the best provider to go to. So when they reformed the system in 2023, hopefully that will change, because like I said, currently there's about 900 home care package providers nationally, which is just amazing for clients because it's just a huge service navigation nightmare. The Disability Royal Commission is also identifying some of those practices as well. They've done a few sort of newsletters and interim reports, but the Royal Commission for the disability sector is still happening, and it's been extended due to COVID. So at the moment, the only thing that I can say is that you're your best advocate. If you are in receiving aged care services and you're not happy, make that known to your provider. Give the provider the opportunity to either provide better service or look around and see what else you can find. There's hundreds and hundreds of home care package providers, for example. So, you know, hunt around. The same is for NDIS as well. If you're receiving services and you're not happy, you are able to swap to a different provider. There is absolutely no reason that you should not be able to go from your provider to another provider if you are unhappy. So make sure that you know that you are absolutely going to be your best advocate, and you can move services if you need to. You need to be happy.
And I guess going on from that, again, with the My Aged Care package, if you do change from one provider to another, is there a penalty? And again, how do you avoid that if you are not happy with the service that's being provided by your provider?
Read your terms and conditions when they come and meet with you. So they'll get you to sign a home care package agreement with them, and it will clearly state what the exit fees are, and they charge that out of your home care package. Your side's been a positive nudge in the industry. There were some providers charging quite a lot of money for an exit fee. We charge about $250, and to be honest, we often waive it, because if we're not really doing our job and you're not happy with us, why should we charge you for the privilege of that? Do you know what I mean?
Yeah.
But yeah, providers, it can be anywhere from, you know, $1,000 up to, I think the biggest one I came across was about $3,000. So they charge that out of your package. And there's usually, it says that you need to give them 2 weeks notice written or something along those lines. But yeah, providers do have exit fees. Yeah.
Okay. And I'm just going to ask Rachel if she's got any more questions come up on the feed, because I cannot change between the live feed and the feed. So I'm hoping she's going to be able to do that for me. I don't know what's going on again. Thank you. Okay.
Great. I'm glad it's you and not me, Michelle.
Oh, good Lord. They don't pay me enough. That's what I'm saying. Let's see. What eligibility criteria is there to get involved with Carers Gateway?
You just need to be caring for someone.
Okay.
Yeah.
And can health professionals get in contact with your side and refer patients directly to you to assist them in getting their plans and funding organised?
If it's regarding Carer Gateway, we are funded for Northern Sydney and Western Sydney. So if your patient falls in that area, you can hop on our website. We've got a direct referral form for Carer Gateway. And if you're talking about aged care services, yeah, you can call us anytime, and we'll happily help you navigate through, you know, that process as well, if that's what's needed. If you're wanting to get onto Carer Gateway and you might live outside of the area, the information for the providers is actually on the Carer Gateway website, so you can hop on there. But usually the 1-800 number is the best way to go, and they're usually happy to take a bit of information for you on behalf of the carer.
And is it likely that the NDIS age will be lifted as we sort of move forward, or does it look like it will remain under 65?
I don't know if there's anything happening in the background with regards to the age, for NDIS. I'm hopeful that the Royal Commission will identify that, if you have a, stroke, for example, when you're 65, the aged care system doesn't meet the need, and NDIS would be much better for you. But I think at the moment, there's not been a huge amount of discussion, but certainly within the industry, we're all hoping that the age limit is removed, because it is really, it's just not, it doesn't meet the need appropriately for people over 65 that have a disability, and it's not related to being older.
And I guess that comes down to the fact that often under an NDIS plan, you can be funded for, direct services going forward. And by that, I mean allied health services. Whereas under the My Aged Care package, that's not able to be negotiated. Would that be correct?
Look, you can get allied health under a home care package, but the cost is huge. So if you've got $52,000 a year that you're able to spend on services, which can be, like I said, about 17 hours a week, when you're paying for an allied health service out of that, that limits the amount of hours you're going to get in a week. So instead of getting 17 hours a week, you'd probably only get 10 hours a week, because you'd be paying for allied health services, which are quite expensive. The difference is on a home care, on NDIS, is you get given a plan and a budget according to what your need is. So in 12 months for aged care on a level 4, you get $52,000 a year. But in 12 months, if you are on NDIS, you might get $300,000, $400,000, $500,000 a year. So the ability to access those really essential allied health services is really, it makes a big difference. It really does.
Okay. All right. Well, that brings us to the end of your time. Thank you, Jane. And I really do appreciate you coming online and giving us an overview of all three, because it's a very difficult system to negotiate and to understand. And you seem to have a very good grasp of all three of those. And I really appreciate your time this afternoon. So thank you very much. And I look forward to meeting you face to face in the not too distant future.
Oh, wouldn't that be nice? Thanks, Michelle.
Wouldn't it ever?